So there's a question from Mahesh. It goes like, my friend was asked to use a machine as he is having low oxygen levels during sleep. Will that have side effects?
So depends on what machine is talking about. Low oxygen levels, they could be giving different machines. Like one is oxygen machine, right? So you could give supplemental oxygen to help the hypoxia, what he's talking about, hypoxia during night. So Mahesh, basically the hypoxia part can be easily resolved with the oxygen. The hypoxia typically caused by lung diseases, so let's say COPD or interstitial lung disease, pulmonary fibrosis, and rarely asthma. But a lot of people who are obese also have obesity, hypoventilation. Those people, if they only have low oxygen levels, giving oxygen is reasonable. And not worry about the CPAP machine or positive airway pressure machine, which we typically give for people with sleep apnea. So the sleep apnea folks, when they drop the oxygen, just giving the oxygen is not going to help, because remember we talked about the street being narrow and congested. So even if you're pushing some things through the narrow street, you're not going to get to the other side because the traffic is jammed, right? So same thing, your airways collapse. So just giving oxygen doesn't make the sleep apnea go away. So you need to give additional pressure, which kind of acts like a stent in the airway, and that causes it. So I see Mahesh saying sleep apnea. So sleep apnea, if it's causing low oxygen, it's also causing other side effects and complications we talked about, like causing irregular heartbeat, irregular blood sugars, blood pressure. So all those things need to be resolved. So it's better to give the positive pressure, which is the CPAP machine, or sometimes we do something called as a BiPAP machine, which is like two different pressures, one for inspiration, one for exhalation. So the positive airway pressure helps much better for sleep apnea. Only the oxygen, giving oxygen support doesn't cut it. So I would strongly recommend your loved one to be using CPAP. And it's very safe, so it doesn't cause any side effects. Although people worry about dependency, it's not really going to cause dependency, and it's actually helping your multiple systems in your body. Although you don't see it, you're basically seeing a lot of benefits, hidden benefits, which we only see during studies. So some people who are really tired and sleepy during the daytime see that effect, improved effect of those. But what's happening to the heart, what's happening to the blood sugars, blood pressures, you're not really seeing them, but they happen. So it's better to use CPAPs for sleep apnea rather than not using it.
Mm-hmm. Thank you so much, Doctor. And Mahesh, if you want to consult with Dr. Kiran and get a more personal advice on this, you can contact us on My American Doctor website, the link is in the bio, or you can call on 9914941494. Okay, I think this brings us to the end of our session today, Doctor. Thank you. That was such an informative and deeply insightful session. Thank you so much for taking the time.
Thank you, Rohi. It was my pleasure. It was good. Again, I think to keep your lungs healthy, few things you want to do, just take home is don't smoke, don't gain weight. If you're obese, start working on losing weight. Keep yourself exercising, do like 30-minute aerobic exercising every day, if not more. I think those things will help and keep you going. All right.
Mm-hmm. Thank you so much, Doctor. I can't imagine how busy your schedule is most of the time. Thank you. Have a good day.
Thanks a lot. Good day, everyone.